All right, good evening, everyone.
Good evening.
Thank you. I want to welcome everyone to the Audit and Finance 2023 Finance Committee and Agency Budget Review. The department heads are here, and you will be asked a series of questions related to your budget and are expected to answer as completely as you can. If there are any answers to our questions that cannot be provided at this time, then just please indicate when you are able to provide them to the committee. Legislators have been provided your written responses to our budget information request letter. And so we thank you for your cooperation in providing them. However, in order to complete a more thorough examination of our budget, it may be necessary to forward you some additional questions after tonight's hearing. For example, there may be a budgetary or spending trend questions not asked at this session, but will be forwarded directly to your department by staff for a response. I will ask each agency head to provide a brief summary of your budget and how it meets with your department's needs for 2023. So I'll begin now, and I'll ask the majority counsel, Rebecca Kennedy, to please take attendance.
Sure, Madam Chairwoman. Ms. Willingham?
Present.
Here.
Here.
Bergdorf?
Here.
Clay?
Here.
Graham?
Here.
Mr. Ray Joyce is on his way. McCaffrey? Yep. Mayo?
Here.
And Bruce is excused. 7 currently.
Thank you. I would like to go down the table now, and all those that members that are present, I'll start here on this side. Please state your name so we can acknowledge your attendance at this meeting.
Sam Fine.
Mickey Clary.
Frank Camiso. Carolyn McLaughlin.
Gil Ethier, Sean Gordon, Bill Rickard,
Dennis Feeney.
Vicky Plotski.
Okay. So tonight we also have with us our minority leader, Mr. Muriello, and also our chairman, Mr. Andrew Joyce, and also our majority leader, Dennis Feeney. Thank you. Are we going to move forward here? I'll let you know what the order in which we are going to take, move with the hearing tonight. We're going to start with the Veterans Bureau, and with Mr. Secor.
Good evening, everyone.
Good evening.
Our budget for this year has not changed much from this past year. For next year, the base salaries have not changed. We have added one enhanced pay line. The reason for this is this past year, we started a veteran peer support program, and that is being combined with our confidential secretary, who is serving as the coordinator for the peer support program. As far as all our contractual expenses, as I stated, most of the lines have stayed the same, with maybe just a slight increase. The one line that decreased, that we didn't add this year, was 44046, fees for services, because that money was for a grant from New York State, and we were not sure if we were going to get that funding this year. We are expecting the funding based on our performance of the peer support program this year. So if we do get that this year, we will do a budget amendment to get it added in.
All right, thank you very much. I'm going to allow my deputy chair of the Audit and Finance Committee, Mr. Peter here. He'll start with questions.
Thank you, Madam Chair. Thank you, Director Seeker. Just two sort of quick questions for you. The first one is, besides your unionized staff, or, and this would be a generalized question for almost all departments, how would you rate the success of your senior staff? Like, how do you evaluate their success?
The way I evaluate them is I look at the progress that we've made in VA claims and stuff like that. Matter of fact, between 2020 and 2021, we saw a decline of 559 veterans within the county. And even though there was that big of a decline in the county, we were still able to bring in an additional $234,000 in VA compensation. So we're making more with less.
Excellent. And then one final question, if you don't mind, Madam Chair. Thank you very much. Just with the Dwyer grant, which we know is sort of how we've created this bureau, is there any risk to it not being continued for the foreseeable future? From the state level and things like that, things out of your control.
With a New York State grant, there's always the possibility that we're not going to get the money. All indications are that we will probably get it. From what we've been doing so far, we've been successful. So I think that they will give it to us, but again, it's a year-to-year thing. I predict that eventually down the line, it will be one of those permanent things in the budget. Veteran suicide is very, very in the news, and it's a high priority for the governor, so I do believe that eventually it will be a permanent thing, but right now it's year to year.
Thank you, Director Seeger. That's all I have, Madam Chair.
All right, thank you. Chair recognizes Mr. Bergdorf.
Thank you, Madam Chair. I have two questions for you. One is sort of a follow-up on Matt's. I saw in the budget, and I don't know if I'm reading this wrong, but under revenue, you zeroed out management budget zeroed out the Dwyer grant funds. It's not showing.
Correct.
As
That-
income.
The,
So, let me finish. So you have a budget that doesn't include that as revenue at this time, but hopefully you'll get the money.
Yes, sir.
Okay. So, Mr. Riley, it's okay, even if they don't get the money, the budget's good.
So as Mr. Secor just stated, the budget currently excludes those funds on both the appropriation and the revenue side. So if he does get the grant awarded, he will come back to a budget amendment, add that back into his budget, so he's able to accomplish all of those additional.
And I have one more question, and this is just a point of information. On your highlights, from what you sent into audit and finance, it indicates compensation veterans are receiving. In 2021, it shows $48,413,000, and that you filed approximately 160 new claims in 2022. Can you tell us what types of claims those are?
Sure.
What's the gamut?
So the gamut runs anywhere from somebody had a broken toe in service and now they've got a limp to serious diseases caused by Agent Orange. The military a job out here is designed for your protection. In the military, the job is designed to get the mission accomplished. So the safety, there's mitigating things you can do to mitigate, but you never reduce all the risk. So military members get hurt. So we help them get the compensation that the government has allowed for their pain and suffering, basically. One of the big things this year is the PACT Act was passed, and there was a lot of presumptive conditions added in reference to Camp Lejeune, drinking water, Agent Orange in Vietnam, and the burn pits for Iraq and Afghanistan and the Middle Eastern countries. Since that act has passed, we've seen a big uptick in claims. Matter of fact, just this past week, we did 23 new claims, and they're all mostly in reference to this new PACT Act. So those are the types of claims that we do.
Thank you, and I just want to say, you're up to 131 outreach events for 2022. Congratulations.
Thank you, sir.
Thank you very much. Trustee Graham.
Thank you. Yeah, I'm looking at your item 15, which is one of my favorite items in these memos. It's performance metrics. One of the things I'd like to do is compare performance metrics in item 15 to the goals of the department. For example, you list as one of your chief goals, guiding veterans as they enroll in the VA healthcare system. I would like to know, well, how many veterans did you help get into the healthcare system? For example, you don't have to have it off the top of your head, but I'm trying to, go ahead.
I would say that would fall in line with our new claims numbers. Basically, when we have a veteran call us, that's one of the first questions we ask is, are you enrolled in the VA? If they're not enrolled in the VA, we get them enrolled, and then we follow on with the claims and everything else.
Yeah, I mean, that's a quantifiable number. How many vets did you enroll in the healthcare system? Because that seems to me that's a pretty clear outcome that has
Yes.
significance. They're the kinds of things I'd like to keep track. But
Right.
also, you mentioned veteran suicide rate. I'd be very interested in knowing what that suicide rate is in the county last year versus this year. Seems to me that is something we really want to track, and also track how you have impacted that as an agency.
The overall numbers that we get from the VA is nationwide. I will try to figure out how to narrow that down for Albany County, but I'm not sure that there's a way to get those numbers out of the VA. But what I will tell you is back in 2018, the suicide rate was about 22 veterans a day. The VA just put out a new study about a month and a half ago, and the number is down to about 18 per day. So the efforts are working. As far as our office, doing the outreach that we discussed, the 131 events that we've done so far this year, that's where we're, between that and our peer support group, that's where we're getting the message out, providing mental health and physical health, which all combine together. So we're looking out for the veterans' overall health and trying to get the message out.
And the outreach reasons, the reasons why you're outreaching is to deliver these really key services.
Absolutely.
And that's really what I want to see quantified, is how we are, if we can, affecting the suicide rate, how we're getting them on health care, as opposed to, say, placement in flags and in cemeteries, which is nice, but it's compared to the other two things, they're much more significant.
Yes, sir.
Thank you, you're doing a good job.
Thank you, sir.
Thank you, Madam Chair.
You're very welcome. Are there any other questions from Ms. McLaughlin? And as you ask your questions, could you please speak up? This is an open room, and our voices are kind of low, so ask your questions and so that everyone can hear you, and please provide your answers so that everyone can hear you. Those of you that have masks, be mindful that you may not be understood if you don't try to, be more distinct in asking your questions, okay? Carolyn?
Thank you, Madam Chair. Thank you so much for being here this evening, and thank you for all the work that you do. I just had a question. Of the veterans that you interact with, do you track a number that are unhoused?
We work with the VA. Anybody who is homeless that we deal with, we send to the VA, because that's how we get them into the system, is they go to the 10th floor. There's a mental health and a homeless division up there, and then they work with the veterans to make sure that they're enrolled, and then provide the referral to get them housed and everything. So that's where our numbers would come from.
So I know the county does have some housing, limited.
In Albany County, we work with the Albany Housing Coalition. Well, that's who the VA refers them to, is the Albany Housing Coalition. And they have a house just dedicated to veterans.
Okay. But the department itself doesn't have a tracking system.
No, because we refer them, we get
You refer
them
them out
linked
to-
up with the VA and everything. And the issue is they have a right to deny the help or accept the help. So, we could send up 20 referrals in a week, but, maybe only 10 of them take the housing. So it'd be really hard to track that number.
Thank you. Thank you.
Any other questions? I have one.
Yes, ma'am.
You serve a very large, vulnerable population. People, you know, many different races might be challenged in one way or the other. Do you feel satisfied with the resources that you have in order to help these people at a maximum level? I also would like to know, have you seen an increase? We know we have a lot of young people coming home from Afghanistan and places such as that, which I guess we would say would be where our new veterans are coming from. Do you feel that you are able to adequately provide for them?
Yes, ma'am. Working with the county executive's office, they've been great in providing us with all the resources and funding, requesting the funding that we need. So far, there hasn't been anything that we haven't been able to do. So right now, we're good.
Okay, thank you. Any other questions from any of the members? Chairman.
Hi, Director Secor, thanks for being here tonight. You mentioned briefly the VA claims that come through our Veteran Services Bureau. And if I'm not mistaken, those claims come through our office in the county to kind of set the stage for success as individuals go to the VA, or the big VA, to get their claims met. So based off what we have in hand right now, what is the usual success rate for what we have with the claims that come in through us to get checked and worked on to go forward to the VA?
I would say that of the claims that we send in, we've been very successful in getting each veteran at least something. All right. The VA, as some of you may know, the VA has a tendency to always say no. So if they do say no, that's not the end of our story. We file appeals. We go out and we find other documentation to submit so that we can get those yeses. Now, we may not be able to get every condition, but we usually do get every veteran something.
Just as a caveat, anything going forward that you need to help with that success rate, to move resources to make that a bit easier for individuals approaching us, for help. You mentioned the PACT Act and burn pits and Agent Orange and suicide, so anything going forward that you need to help with the success for that, keep us posted and we'll help out.
Yes, sir.
Thank you.
Any other questions? If there are no further questions, we want to thank you for your presentation tonight and all the work that you do.
Thank you very much.
Okay, we're going to move forward right now, and we're going to ask Crime Victims Commissioner Karen Ziegler, and for those of you that are looking in your books, your budget books, page 99, starts on page 99 in your budget book.
Good evening, Madam Chair. Good evening, members of the legislature. Thank you so much for your time. I appreciate it. As many of you know, I can talk all night about crime victims, so let me try to be succinct. We are incredibly fortunate to have found ourselves in the position of having multiple year grant contracts. So our funding is as secure as it can be in these economic times. You know, I am always looking for more grant money, and I believe that there is more money to be found. We serve our victims and all of Albany County in such a way that I hope that every single person that interacts with us walks away feeling that their lives have improved. That is our goal, that every single person that comes into contact with us walks away feeling that we know that their pain is important, that they matter to us, and we want them to move forward with their lives. We are incredibly fortunate to have an increase in our grant funding from Office of Victim Services, and with that, we've been able to increase our staff by 3 positions. These have been difficult times, I can't say even post-COVID, these have been difficult times, and the crime rates have gone up. I'm sure our department, as every department, has dealt with a lot of staff transition, the DA's office included. Some of that transition has created opportunities for cases to be sent back to crime victims from the DA's office. So we have seen a significantly increased caseload past couple of years. So we've added a crime victim caseworker to assist with that. We're also shifting our policy. We had dedicated specific caseworkers to specific courts. That's great for courts, and that's helpful to us, but I find that that's not necessarily helpful to victims. We're changing our process. We're going to dedicate a caseworker to a client. So if that client has a case in family court, in Cohoes Court, and in Albany Court, that caseworker will follow that client through every single court. So they're dealing with one person. They're not getting 3 different phone calls, they're getting one person for returning those calls, and we do the legwork with the courts, and we get them the answers that they're looking for. So our additional caseworker is going to allow us to facilitate that so that we are more streamlined in serving our clients. We are adding a community engagement liaison. We've had incredible interest in our internship programs. Colleges, and we're very fortunate to work with all of our colleges, and I'll talk about that in a second, look for internships for their students, and a lot of places have had to pull back for a number of reasons. We haven't. So we have doubled our trainees. So we are constantly looking to recruit, to train, and retain our volunteers. We offer a mentorship program. We think it's very valuable to offer our interns and volunteers the support that they need. I don't think I need to tell you that our work is very hard. It's difficult work. And it's particularly for when you're 21, 22, when you're a young person, you may not appreciate the nuances that life can bring to a crime victim, the vulnerabilities that our crime victims can have. So we want to make sure that they're mentored, that they have someone constantly in their corner 24/7. They can make a phone call, that they're going to get the help that they need, not only to help the victim, primary priority, but to help them. If they need to process, if they have questions that need to be answered, if we have something that we need to do on our end, we can make that happen. We're also looking to serve more campuses. They're very involved and engaged with us, so we've maxed our capacity, so our community engagement liaison is not only going to help us with our volunteers, they're also going to help us on our campuses. So we can have more availability to those, because that is the highest risk, honestly, that age group. And that red zone for those 18, 19-year-olds going to college for the first time, September, October, is a red zone for us. We know that's going to be a high risk of being victimized in any number of different ways. We've also partnered even more closely with USCRI because we know those immigrants and refugees, and we've had an influx of immigrants and refugees. Thankfully, Albany is welcoming in an amazing, amazing community that will afford people opportunities. We've partnered with them. We've done additional training with them to help immigrants and refugees who have been victimized on their journeys. Oftentimes, being a refugee creates opportunities to be victimized multiple times. And then they come here, and sometimes their welcome isn't as safe as we'd like, let's just say. So we're serving more immigrants, we're serving more refugees. We've built up that partnership. We've also partnered with our amazing DCYF. We have one Bridger position, our volunteer coordinator, who is also their family advocate, but we partnered with them to have the Safe Harbor coordinator, which is a person who works with the commercial sexual exploitation of children, to become our human trafficking coordinator. So they're not only assisting with the CAC, they're also assisting with trafficking victims. And we can wrap crime victim services around those victims. So it's increasing their access to courts, to therapy, and to case management. So we really feel that this particular support system for each of those victims will help them recover and move on with their lives faster. So that additional grant money assists us with that. We are so fortunate that the county executive offered us off-site clinical space. We have a space on the western side of the county that's a home that's been transformed into a clinical setting. It is beautiful, and I want to surprise you because I'm asking the county executive to feature it in his State of the County. It's gorgeous space, and it is warm, and it is welcoming, and it is affirming. So that allows us to better serve Hilltown folks because it's on that side of the county. They don't have to come downtown. Coming downtown can be a little intimidating for people. It has a parking lot. Again, it removes that obstacle for people seeking services, so we can better serve Hilltowns. Our caseworkers, again, dedicated to the outlying courts, which is very important. So making sure our Hilltown folks feel that they're represented, that they're cared for, that they have equal access to our services, and that we're paying attention to what's going on out there, and we want to help them. Additionally, our Department of Health grant. So you had a question about the safer bars. They have given us an initial $10,000 that is in our fees for services around our Safer Bars project. If you're familiar with our Safer Bars, it's around healthy nightlife. COVID decimated our bars. It's been a challenge. All the bars we've partnered with are struggling. We're broadening our definition of healthy nightlife. We're working with In Our Own Voices, the Pride Center, and Empower to look at those spaces that folks gravitate towards that may not be alcohol involved, that might be game playing, poetry jams. There's any number of them. So between those three groups, we're looking to really work with our LGBTQIAA+ community. We're looking to work with our communities of color so that we're out there where they are. Our LGBT communities have been providing safety for their communities for so long. They deserve a hand, and we want to step up and provide that to them. So we're looking to partner with new community agencies, new community groups, to have healthy nightlife represented so that they know the staff and the people who frequent are trained and educated in how to identify sexual aggression and what to do if you notice it in ways that are safe for the individual. We don't want anyone going out there and putting themselves at risk, but there are many ways, subtle ways, that can diffuse a situation, can de-escalate a situation, and we're trained in that, and we want to reach out to our community partners and help them help people so that the price of a nice night out isn't being sexually assaulted or harassed.
I want to thank you for your presentation.
Thank you.
It is quite thorough. Just want to remind everyone that this is Audit and Finance Budget Session number 3, and this is the Human Services Part 1. You'll notice from the different departments that's coming before us, and also I want to recognize the presence of our one of our committee members, and that is Raymond Joyce. I'm now going to entertain questions from my deputy, Matt Peter.
Thank you, Madam Chair, and thank you, Director Ziegler. Quick thing is the Safer Bars initiative is great. It was very helpful to a lot of the Lark Street bars that participate in it. And I would also encourage you to reach out to the other business improvement districts as a way to, help educate and also let people know what's going on. But with that, I'll start off with the same question I sort of asked before, which is, outside of unionized staff and things like that, how do you rate success among your senior staff or your, the leaders in your organization?
My senior staff each have a team. We have a community team, we have a clinical team, we have a court team. I rate them on what's called a PMT. It's a performance measurement tool. So I look at their numbers. I look at how many clients we're seeing, how many cases we're addressing, how many hotline calls we're responding to, how many ER visits, how many public speaking engagements we've involved with, how many schools we're doing. We collect a lot of data. All of our grantors want data. So I see reports on a monthly basis, and I evaluate those reports, and I evaluate those teams.
Great. A couple of other questions if I could, Madam Chair?
Yes, ma'am.
Thank you. One of the things that you answered very well was about the marginalized populations and reaching out, especially amongst the immigrant community that we know can be taken advantage of. I guess the question I have is often we see a lot of success earlier on in the process or through the legal process, but often we see individuals who are in repeat circumstances, often not through circumstances on their own, but what's foisted upon them. So I guess the question is, what are we taking to additional steps to ensure continued success of individuals, crime victims, and those suffering from domestic violence, to ensure their success and transition in a away from the system?
We have 2 case managers, and those specific people that you're talking about, we look at as people needing maybe a little extra hand. So those cases can be referred to our case managers who can stay with them long term. Our core advocates are more short term. It's around the case resolution, and when the case are disposed of, they would move on from our caseworkers. But our case managers can stay with those clients long term, 6 months, 9 months, a year, and they can go with them to appointments, and they can advocate with them with employers and with housing and with they can go to DSS if they need to. They can go to healthcare appointments with them. They can assist them with getting mental health care. So our case managers are, I think, the bridge between the immediate needs and the long-term needs.
So is there at all a gap in what you're seeing in certain fields? So for example, sometimes housing is an issue. And do you feel that you have the adequate funding to accomplish that, right? Like to really sort of seek out those needs?
I would say crime victims has adequate funding, but I will say absolutely, housing is one of the biggest obstacles that we face, one of the biggest things that our case managers work with, and I think this is global throughout all of our systems, throughout all of our agencies. Housing, affordable, safe housing is at a deficit in Albany County. If there's anything that the ledge can do to assist with that for all of our departments, I think that would be incredibly helpful to all the people that we serve.
And I think the legislature and many of my colleagues are interested in ways we could help if there's some ideas or things that we could work with the executive's office on. One final question, if I may, Madam Chair.
Yes.
In it, you talked about, in your budget, you talked about services provided, Geek Squad, Apple iGenius, et cetera. Could you describe that a little bit?
I think you hear on the news sometimes that child pornography is identified by those people who look at people's computers. So by educating people who may come into contact with someone's hard drive or someone's computer,
Got it.
that could just let them know.
That's great. We just weren't completely sure what was going on with that, so
Yeah.
that's great. Thank you.
Sure.
I'm all set, Madam Chair.
All right, very good. Are there any other questions from members? Yes, Mr. Mayo.
Just a couple quick ones. Karen, on page 100 in the budget, it says compensation claim, 0.6%. What is that? I just,
Mr. Mayo, could you just ask that question again in a little louder?
oh, sorry, yeah. On page 100 in the budget, there's mentioned a compensation claim, 0.6%. I just didn't know what that was.
The New York State Office of Victim Services is our largest grantor, and they allow crime victims to file a compensation claim. They are the grantor of payor of last resort. So if you are the crime victim in Albany County, we will assist you in completing a crime victim compensation claim, which goes to the Office of Victim Services. They fund that, but again, although that is we do that with every single person. That is just a tiny fraction of what we do.
Okay, and then one quick question. The crime victim therapist, what's the education and training background for that?
Our crime victim therapists are all master's level credentialed licensed clinicians. They come to us with a bachelor's and a master's level. They receive weekly individual and group supervision. We give them an additional 40 to 50 hours of specific trauma-informed education when they start with us. And it is very highly supervised and supported.
Okay, thank you. Thank you, Madam Chair.
Thank you very much. Ms. Bergdorf.
First of all, it's hard not to notice in your budget that virtually everything is paid for with a grant.
Yeah.
Congratulations.
Thank you.
Can you tell me a little bit about, I understand, I think I understand what it means to be a crime victim. And obviously, many of those, or some portion of those, come from court dispositions and court actions. But you also, I assume, have various other levels of intake of crime victims that have not yet been to see the DA or to see their police agency or whatever. What's the kind of breakdown between the people that you serve that are coming out the back end of the criminal justice system, or just say, wow, I'm a victim, let me reach out to the victim's advocate for some advice on what I should be doing, whether it's reporting a crime or seeking some other legal redress?
Thank you. I would say a lot of our court advocates, obviously, I would say pretty much 100% of those victims that we serve come from the criminal justice process. But filing a police report or having any type of criminal justice interaction is not a requirement for services from crime victims. I would probably say it's about 80 to 85% are involved with courts in some way, and about 15% are not, for any number of reasons. There's a lot of reasons the communities of color are not engaging with the legal system, and again, we can still provide any number of resources to them and support to them. So it's not a requirement, but I would have to say, just by sheer virtue, by far the majority of our folks are or were at some point involved in the legal system. We get folks who call us sometimes years later. Sometimes we get folks who are living in Albany County that were victims elsewhere but are living in Albany County now and just now are trying to deal with flashbacks and memories and issues that are they're part of their daily life due to their victimization elsewhere.
Thank you very much.
Of course.
Thank you, Mr. Bergdorf. Are there any further questions?
Yeah.
Mr. Grimm.
Thank you, Madam Chair. I like your Appendix C, Karen, because it has 8 clear practical outcomes on what gives your agency value, which so hooray for you. The one other suggestion I might have is feedback from your clients. Do you ask them to, simple as, sometimes it's just a simple page.
We actually do, if I can,
Yeah, yeah.
we do a lot of outcome studies, so we have performance and, so we measure not only our performance, we look at how quickly do we return calls, are we respectful, less so with COVID, although our waiting room, we talk about, every single program has an evaluation and a survey, so we do collect them. So we ask our performance, and then we also ask a like, how do our clients feel? Do they feel that they moved on? Do they feel that they're sleeping better? Are they eating better? Do they feel safer in their lives? Are they able to engage in community activities and engage with their families? So we actually do collect that. We don't report that, and I could if you want me to, but we do get satisfaction surveys and performance surveys, but we ask them. I have to say, it's like every other survey. There's not necessarily a robust response, but we ask everyone because our grantors want it and we want to know it. I look at those surveys, we analyze the trends, and we have made corrections and modifications in our processes based on the responses of the surveys.
Yeah, I think that's an important quantification. What do your customers think of you?
Absolutely.
I mean, that's really important, and it also gives them some insight on what they see as
Yes.
value, as opposed to what you or your staff might see.
Absolutely. I completely agree.
Thanks.
Of course.
Thank you, Madam Chair.
I warned you I could talk about this all night long.
Okay, thank you very much. All right, are there any other questions from any other members? Very good. Thank you so much. We appreciate all the hard work that you do. And I have a question. There are a lot of people, we know there's been a lot of gun violence
Yes.
in the community. And there have been many people who have not been part of the violence. However, or how should I put it? They have not been the perpetrators, but they have been bystanders who had been injured, okay? Do you know how many of those people you have been able to serve? And how do you seek those people out? Do they come to you? Do you get information from the police? How does that happen?
We work pretty closely with SNUG and Urban Grief, and they are really boots on the ground when it comes to intervention in the community, because we know actually with every act of violence, there is a whole network of people who are immediately impacted, not only the family, but the community, the neighborhoods, the bullets that are in people's cars, in people's windows, in the homes, the children who go to school in the morning and they see shell casings and any number of detritus from crimes on the street on their way to school. So we work very closely with them. Again, you can be affected by crime to receive our services. You do not have to be the immediate victim, but just if it's on your neighborhood, if it was next door, if it was a friend of yours, just if you're affected by crime, you can receive our services. So we work very closely with them and we accept any referrals.
Okay, thank you. Thank you very much.
You're very welcome.
All right, thank you. All right, Social Services is next. And Commissioner McQuaid. The information for social services can be found on page 169. Good evening, Commissioner. How are you?
Good evening. Very well. Thank you.
You may begin at any time, and I just want to, let me see, who do we have with us this evening?
So I'm Michelle McClave, Commissioner, DSS. I have Joe Viscuso, Director of Accounts at DSS.
All right, thank you.
My right-hand person when it comes to budget.
You may begin.
Good evening, Madam Chair, members of the committee, members of the legislature. Thank you for having us here tonight. We're presenting for DSS for 2023 a budget of $134 million total, with $69 million of that being the Medicaid required share, the remaining $64 million to operate the programs and services which are mandated by New York State for the Department of Social Services to provide. We are looking at basically almost a flat budget with a appropriation of decrease of 1.4% with a 0.2% county share increase overall. In looking at some of our, we've also just added a little bit in regards to our workforce development plan that we did last year, a couple years ago. We're still continuing with that. We've changed the job descriptions for our RNs because we had a significant difficulty in recruiting for nurses for DSS over the last couple of years. So we have altered that job description to better reflect what an RN will do at DSS. It's not a hands-on RN, it's not a direct service RN. It's specific to our home care assessment that is ordered by physicians. So we have changed the job description and the title of that, and we've also increased the salary, so we're hopeful that both of those things will help us improve our recruitment of the RNs over the next year. We've also looked at adding a data management and fiscal integrity coordinator, and this is to help maybe get us 1 foot in the 21st century with data. We are still dealing with data systems from New York State that are from the 1970s, and we don't really have, we have several dozen different data sources that we must utilize as required by our 4 New York State oversight agencies, and we also have some internal data programs. And just to help us get a handle on all of those different data sources and how we can best utilize them, how we can best dig into that data and look at trends, look at revenue and expenditures and program outcomes. So to help us really focus on improving that area, are there deficiencies, are there duplications, those kinds of things, and also then to help us work with the new initiative that's occurring in the Division of Management and Budget with data integrity and data oversight to have a single source of data for the county outcomes. There were a couple other questions that people had. Do you want me to go into some of those? I'll just talk about workforce a little bit, and I'll just reiterate probably what you've heard from every other department. We are, as is every Department of Social Services around the state. I talk to my colleagues around the state, and everyone is having a significant workforce recruitment problem right now. And you can see from our attachment that we have quite a few vacancies. We are working every single day to recruit people, to do interviews as quickly as we possibly can, and to onboard people who come to us that meet our qualifications and are willing to work for us. So we hope that will continue, our hiring will continue through 2023, and we're going to do some catch up and increase decrease our vacancies over the next year. It has been a little bit of a challenging time with the workforce over the last year, again, as everybody has been having. And there's we're asking for flat funding for our ISIP program that should be sufficient for what we're able to do over the next year. And we do have 400 hours per week of unfilled home care hours in that ISIP program because, only because the agencies, the home care agencies, do not have enough home care staff. So we have requested of them that they fill these hours. They are unable to fill those hours. So we, unfortunately, not because of lack of need, but because of the lack of available services, we are not necessarily able to fill all of those hours. But we try every day. And so I just present, we feel very confident and comfortable in the budget that we have presented, that it provides adequate resources for the Department of Social Services to perform our required functions and mandated duties, and serving the most vulnerable people in Albany County in the best of our ability. And so we're open to any questions you may have.
Before I open it to the floor, I'm looking at all of the vacancies that you do have, okay? How do you feel the services that your agency provides, how have the people been impacted by the numbers that we have lost as far as folks that, you know, will be able to provide? And can you point to specific services that have been affected?
Well, the home care is one of them, and that's not necessarily reflective of our low staffing, that's reflective of the staffing in the community. I think for us, it's probably not so much, the clients are not so much impacted as is the staff. Because a lot of what we do is enroll people in benefits programs, and we're not necessarily getting to maybe a recertification, but their benefits continue. So it's not like somebody's being cut off because we're not able to get to their paperwork. It's really a paperwork processing. And so I don't know that there's benefits that are not being allocated or provided. It might be slower, for instance, or recertifications might be slower.
I have, the chair of our Social Services Committee here, Sam Fine, I just have one other question. There's something that has come up. Is there a period of time that the offices are closed during the day?
Not yet, but we've been thinking of that.
What about lunch?
Oh, for lunch, I'm sorry. Yes,
Yeah.
they are closed during lunch, yes.
Can you tell us why?
That is because we have union contract, and our employees receive an hour lunch from 12 to 1.
That's everybody?
Yes, the whole agency, yes.
All the union staff.
All the union staff, which is everybody who works in reception. So it's extremely difficult to manage. I mean, we provide 7 hours of operational service, actually. We actually open usually at 8 o'clock instead of 8:30. People start coming in at 8 o'clock, and we close 4:30, but we still serve people at up to 5.
All right. I'll open for other questions right now, and if Sam has, Mr. Fine, if you have any questions, I'll entertain that now from Mr. Clay.
Yes, thank you, Madam Chairwoman. Commissioner, I do want to ask a couple things about homelessness, which you identified as a challenge, but I want to just follow up on Madam Chairwoman's question there. Do you know when those union contracts will be renegotiated? Because that would be a time that we could try to negotiate in there, having a staggered lunch. Of course, they deserve it at lunch, but they don't all have to go at the same time.
They're currently being renegotiated right now.
They are. Is that part of the negotiations?
I can ask the Director of Employee Relations. I'm not part of the negotiations.
And we aren't either. We're not part of negotiations either, okay?
Yeah.
I just want to reiterate that.
But we can talk
And
to
I'm
the
not
county
either.
executive's office. Make it known that that's a concern.
Yes, yes, yes.
Okay. I do want to ask something about homelessness, because you identified homelessness as one of your biggest risks. You talked about, the expected increase in evictions and how that's going to impact it. And, one thing I'm wondering is, are you dividing up, the different groups of people and their reason, the causes of their homelessness? For example, I suppose there's some people who are homeless because they can't afford housing, some people who need assistance in finding housing, some people with mental health issues, a variety of different causes so that we can, figure that out. That'll help us come up with some solutions and try to, get the resources necessary in the right areas to
Well,
address
the data integrity and fiscal coordinator will help us assess a lot of that. Right now, though, I'm gonna be honest with you, we are just housing people as best we can. Our homeless shelters are full to the brim, and we're looking for more space to house people over Code Blue. So our goal in the homeless arena right now, because we have more people than I've ever seen in my 7 years of being here. I have never seen the homeless problem like it is right now. And all staff can do is make sure someone is sheltered for the night. So we are moving people around, and we have family shelters, so we're moving people to the hopefully appropriate place. And we have a couple, we have other shelters that specialize in different things, so we try to move people to the best place for them. And one of the requirements for the shelters that we contract with is they do case management, and they work with the clients to get them permanent housing. So that's the goal and that they need to be working on for every client. So, there's a lot happening right now in just trying to shelter people.
Thank you. Do you need more resources in trying to house people? I'm curious, the people that are in, shelters now, you're getting into shelters, but what more can be done to get them out of shelters and into permanent housing?
Well, I mean, as I said in my presentation, my packet, we knew that there were going to be evictions occurring over the 2 years of COVID and the eviction moratorium. That kept people from homelessness. And we knew that the Band-Aid was going to be lifted off, and it started this fall. So more people are coming in for evictions, for utility shutoffs, for code problems in their housing. So that's creating many more evictions than we had previously seen over the last 2 years. We have relationships with local nonprofit providers and with motels, hotels, and that's what we do for homelessness right now. So there is a difficulty. You noticed in one of our lines, we have a rent supplement program for a little bit over $1 million. That is a New York State, 100% New York State funded initiative. That will pay monthly rent up to the fair market value for rent, which is more than we've ever had before, which is a fantastic program. We are having slow enrollment in that program because people are having a hard time even finding fair market rent apartments. So
how is fair market rent determined?
It's a HUD assessed for the particular area. And I think it's by county. Is ours by county? Yeah, so it's per county they do fair market rent, which is, when I looked at the numbers when we first got this grant, I was excited. I thought a family of 3 could be $1,300, and we never had that kind of, those kinds of resources. But even then, some families are having a hard time.
Thank you. Looking forward to learning more from the data interpreter position.
Data integrity and fiscal integrity manager, yeah.
Mr. Clay?
Yes, I just have a question, Commissioner. How large is, Social Services apparently is the largest agency in the county, is that right? Did you say?
It's, when you aggregate all of your branches together, I would say.
Yeah, probably the nursing home is bigger, right?
But in terms of the executive or the AFON,
Yeah,
yes.
right.
Yeah, and how many vacancies do you have?
Today, I probably have 75.
75.
Out of how many?
308. It's a lot.
308, yes. Ms. Peter.
Thank you, Madam Chair. I'm going to ask a couple that we ask everyone, and then a couple to Mr. Fine's questions to follow up to that, if that's okay. Welcome, Commissioner, and thank you for being here.
Thank
The first one is, and we asked every department, how do you rate the success of your senior staff? You're not, I understand the unionized issue, but, it's the senior staff.
Yeah, well, we couldn't function without them. We have commissioner level, commissioner's office staff that I work with daily, and I look at how well is the department running? Are we on top of the clients coming through the door? Are they being serviced? Are we getting a lot of phone calls from the state? How are our state audits going? We are audited pretty much every week by some state agency. And are they concerned about us? What are their reports? Do we have performance improvement plans? And how are we responding to those performance improvement plans? Are personnel problems addressed and dealt with? Are my directors meeting with their staff on a regular basis? Are they accessible to staff? Do staff feel comfortable coming to us in the commissioner's office? Are they letting us know about problems, safety concerns, health concerns, personnel concerns? Are we hearing about those things in a timely manner, and are we responding to them in a timely manner? Are we responding to the community needs? I mean, is there, for the homelessness, how are we going to get through Code Blue? And am I getting a plan from my staff on how we're going to house people through the winter so that nobody passes away? So there's a whole range of day-to-day, are we paying our bills? Are our claims processed on time? Are vendors complaining? Contractors, are our contracts done on time? So these are all the kinds of things that senior staff are responsible for and looking for. So we have many divisions we divide the department up into divisions according to the different programs. And I think we have 7, 8. And each of those has a director. And so those directors, we meet with on a weekly basis.
Are the unions all the same for those ones?
Yes, it's one, CSEA is our
Got it.
union for the whole agency.
If I could, Madam Chair, a few more questions?
Yes.
Thank you. One of the big programs you do, obviously, is the HEAT program. We know that National Grid is looking at, I think, a 64% increase in cost. We're seeing that across the city. It's issues from, private users, developers, things like that. Do you believe that you have the resources necessary to sort of take that type of hit and continue providing the services to the individuals that need it?
Well, Albany County does not directly pay the vendors for the HEAT program, except for, you'll see a $350,000 in the budget.
Yeah.
That is only for emergencies. Furnace repairs and tune-ups. Just tune-ups. So there's a couple items that we pay for directly. Most of the other payments that go directly to the utility vendors are paid by New York State.
Got it.
And so New York State has come out this year and had said that there's going to be additional funding in the HEAT program, and also the amounts that a payment can go up to were increased this year as well. So the total amounts are also increased.
What I also ask is, Chairman Fine had mentioned the Social Services Committee had asked about, dividing sort of the homeless populations into what the need is, right? Like, is it folks who need supportive housing? Is it affordable housing? Is it someone is part of the working poor and, just got priced out and temporary things like that? So, but taking a step even further than that, once you get the data person in, I would want to also find out, why is the person here? Were they born in Albany County? Were they seeking treatment at the methadone clinic that now, does 9 counties worth of things? Did they come to Albany Med for treatment and got released and have stayed? And I say that that's important because if we are going to make the case for additional revenues, if we are asked to solve a regional issue, which we understand that this is a regional issue, psychiatric issues, regional issue, and we are seeing a disproportionate amount of things that we are forced to absorb, then that is something that we should go to the state and say, okay, you brought 9 counties worth of those in need of methadone treatment, X amount are staying, that's costing the county X, you know, in that. Or you cut psych beds by 10%, and now those individuals are going to the homeless center. Like, these are, I think, important things to actually figure out, because, you know, when we even think of, like, the city of Albany's costs, when there's secondary costs or people who need help at the methadone clinic, that's purely borne by the city of Albany, right? Even if it's coming from 9 counties worth of issues. And I think we actually have to start talking about that. And as Albany County is home to 3 of the largest regional hospitals, that's only gonna increase.
Well, from a DSS perspective, I can tell you one thing, and that is, the way DSS works is whatever county you came from, we will charge you back. So it's called District of Fiscal Responsibility. So if they are from Rensselaer County and they end up in one of our services, we get to charge them back.
But are we asking
But-
that are we asking that at the homeless shelters and things like that?
Yeah, well, homeless placement to a point. There is something called where found, that is a state law, so that if someone is non-domiciled and, but if they came from Rensselaer County last night, we'll be either sending them to Rensselaer County or we'll be charging Rensselaer County. But at some point, it does become a where found, yes.
And I just think it'd be interesting data. And I guess the final thing, which is off what the chairwoman said, is are you finding at all individuals who need help, but the only hours they can really come in are during their lunch hour? People who are working and can't take time off and things like that. Do you think additional office hours outside of traditional hours might be necessary to make sure that all the individuals getting services can stay employed or assure childcare for what they're doing and to make sure they're receiving those services?
Can I jump in with it?
Go ahead.
We just explained that this is we're in the middle of union negotiations.
Right.
And I thought we just said we were gonna get off of that topic.
So I'm not saying union things, I'm saying, so for example, if someone's working Monday through Friday and we are not, I'm guessing you guys aren't open Saturday and Sunday or at nights or evenings?
No, but there is no need for most people to come into the building unless, again, if you're homeless, we must see you. There's a few things where we must see you. But you can apply for any of our benefits by phone or online at mybenefits.ny.gov. You can apply online, and we can do everything. Temporary assistance, you must see us in person at some point, but those folks are not working. So anybody else who is working doesn't have to come into DSS, and we discourage that. We would like to see those unnecessary visits not to be reduced, because it just creates churn for everybody. So we can do everything online and over the phone. So there's options, I guess, is what I'm saying.
Thank you. We heard your reminder, Mr. Riley. Thank you. So, but I want to get back to the heat here for a moment. Now, who gets the bulk of the heat money? How many households? I mean, we've heard in the past that, the housing authority gets a lot of the money unless there's separate money for them, so forth and so on. Who gets the bulk of that money?
I'm not sure if we have that data. I would have to really go back and look and see if we have that. I'm not kind of like, how would you, are talking about having it divided? What do you mean? Seniors versus younger people? Or, oh, zip code are you talking about, or?
Well, if you want to give to me my zip code, that's fine, okay?
I don't know if we have that.
My real concern was that it was going into individual households. And so, Mr. Porter said that might be a New York State question, but I mean, we know who we serve, is that correct?
Yeah, any application that we receive, if they are financially eligible and have a utility agreement with a utility company, then we will make them eligible. We determine the eligibility, and New York State pays it.
Oh, I see. Okay, all right, I'll let that go. Any other questions from the members? Okay.
Take Cookie first. Raise your hand first.
Okay, so let me do this. Okay, you're a member of the committee, so I'm gonna go with you first.
Okay. Commissioner, I've got basically 4 questions. I think a couple of them are easy. They're math. 75 over 304 employees is 25% vacancy rate. You say you're meeting the need somehow with 75% of the employees. How are you doing it?
Well, I don't know, well, I guess we're processing applications, not always on time. I'm not gonna say we're meeting the need in the way that we're supposed to meet the need, and at this point, I'm saying to New York State, we are going to be behind on certain things. We are behind,
Okay, well,
Yes.
that's
yes.
the acknowledgement that we don't need,
No,
we
No,
don't need 50
we are
or
out of
60 left.
compliance with certain rules and regulations, but we are triaging. We are having to triage. For instance, I'm saying, process these process emergencies first.
So, and you're working on your retention and recruiting as best you can, given the salary ranges that you
Yes,
have.
yep.
Okay. Heat, we talked a little bit about that. I saw in, I don't remember, it was, might have been in your metrics that you submitted to finance, audit and finance, that were, as of whenever these numbers, the snapshot in time, there were 1,463 heat applications pending. And we're going into the winter season, and that is doubling, more than double, maybe almost triple what there have been in previous years. How do you get that done?
We, that was from last year, I think that was from March, wasn't it?
Yeah.
Yeah, so that was March of last year, which is a high, well, November through March are significantly high heat application months. They closed.
But this year with with the price of electricity.
We're gonna get a lot of
gas, et
applications.
cetera,
We're gonna get a lot of
you're gonna get a lot
applications.
more.
We didn't finish processing, I'll just say, this is what I'm talking about, we're behind. We still have about 80 applications from last season that we have not yet processed, and today was the opening of heat. So we are behind, yes. And we can only do as well, not all of these people are eligible, so you have to keep that in mind too.
But people who come in tomorrow are gonna wait a while to.
Yes, and this is what I try to tell the clients also, that, again, we don't pay the bill, New York State does, and it takes them several months to process. And the utility companies know this, though, so they know they're gonna get their payment, so folks shouldn't worry about the utility company not getting paid, they will get paid.
Okay, sort of, one last math question, and then one that's more policy related. It said that you had, geez, I have the number written down here. How many thousand people did you serve that are on Medicaid?
Well, I don't know if I provided that, but at any one time, we have
12 or 24,000?
24,000. I
Okay.
must have
Is that
provided it.
individuals or families? How many families is that?
That's, families is difficult. We provide mostly, we do a lot of chronic care and long-term care. New York State handles a lot of the singles and low-income families or income-eligible families. We handle the temporary assistance families, so there's all these nuances.
I mean, but it's close to 1/6 of the population of the county. on Medicaid. If you use a round number of 300,000.
24,000, yeah.
25.
Well, plus there's more on Medicaid.
12, yeah.
New York State has another 20-some thousand that they manage. We manage 24, they manage 20-some thousand as well.
So there are 40,000
Yes.
total. So now you're up over
Now it's closer to your.
12
Yeah.
to 15% of the county in Medicaid. That's bad. I saw some interesting words in next year's projects. Employment services for temporary assistance recipients by contracting out programs. To focus on meeting mandated employment requirements. The nursing home has had to bring in staffing vendors to meet required ratios and the like. what are you, are you using this to augment the shortage in your staff?
I think you're talking about our program for our clients. This is our employment program for our clients. Temporary assistance, we're actually very excited about this program. It's,
Okay, I read that. Did I
Yep.
read that wrong? Enhanced employment services for temporary assistance recipients by contracting out programs.
yeah, we have a contract with the Altamont program to get people ready for work. What is their barrier to work? Do they have a resume? Do they have a GED? What is it that they need to do in order to get work ready? What kind of training do they need, et cetera?
These are services for
Yes,
clients.
that we refer
It's
clients
not-
to.
It's not filling a hole with
No.
when you.
That's, yeah.
Okay, thank you, those were my questions.
Thank you very much, Mr. Bergdorf. Any other members? Mr. Grimm?
Thank you, Madam Chair. I'm glad you mentioned data. It's an interest of mine, of course, but do we have any data on how many people who are dependent on social services become independent each year? That you have X amount of people in January and then in December. That to me seems like one of the most important questions.
We don't have that right now. I mean, that's probably a New York State Office of Temporary Disability Assistance data. I was at a meeting last week, a statewide meeting with them, and they were talking about the length of stay for people on temporary assistance, and it's 24 months is the average length of stay for someone on temporary assistance. So,
It just seems to me that's, when we judge the value of agency, that's a really significant number. And the ones that do become independent, we want to say, how did that happen? Let's do more of that. And the ones that don't, now a lot of these are beyond your control, which is my next question. A lot of the money that goes to you is state and federal with strings attached. How much of an impediment is that to you with respect to flexibility? Because the rubber meets the road with county employees, not the state and federal, they send the money. So how much of an impediment is that for you to exercise the kind of flexibility or the innovation that you might seem appropriate to fix some of these problems?
that's a very big question. And we're the arm of service for the state. We act as the state's implementer of these programs, and a lot of these programs are federally dictated. So the way we determine eligibility for a program or the requirements that we have for a temporary assistance client, someone who's on TANF, it's completely federally dictated what we're supposed to do with them. We are as creative as we can be, and my goal is to get the benefits to the people as soon as we possibly can, and to on the other end, to try to find out, again, why they're here, and how we can remove the barriers to getting them back on their feet.
Because you and your staff have a unique perspective. You're dealing with the that maybe the state and federal people don't. That's my frustration. I think if we had more flexibility, we'd move more in the direction of the independence that I talked about.
Yeah, and if I had flexibility, I'd probably have to look at models from elsewhere, kind of what works.
Yeah.
Um,
Thank you.
Thank you very much. Ms. Potsky?
Thank you, Madam Chair. Commissioner, if we could go back to home care for one moment. When those hours are filled, the outside agencies can't fill those hours, what's happening to the client in their home, who needs the home care?
Well, every case will be different. We are providing some services to those folks if they're eligible, so we might provide lifeline services, personal emergency response services, home delivered meal services. Maybe maybe laundry services. So we're trying to supplement the services that we do have available and provide those services. And the family often will then fill in the gaps, and it's not perfect and it's not great. Some of those folks might be ending up in a nursing home because we can't fill that. The ISIP program is not as intensive intervention level of care as some of the other home care programs. So those folks yeah, they may be struggling.
All right, one more, so going over to the rental supplemental program. The current funding, about 1.2 or so million, you say can help up to 90 families. So my question is, can you just discuss how that's projected to cover 90 families? It seemed a little like a small number to me. And then also looking on page 178 of our book, back in 2021, there was like 9.1 million in emergency rental assistance.
Yeah.
2022, 1.1 million emergency rental assistance. So, and then that goes to zero. So are these separate programs?
Yes, and this is the confusion that was created by the Federal Emergency Rent Assistance Program, ERAP, which originally we got into the county. Then that 9 million, or most of that 9, but not all of it, was transferred back to the state to administer. And we had kept a little bit of it, like $1 million, I think, for our own outreach and engagement and helping people enroll, and we also provided some of that to a couple contractors for that. That's pretty much done for us. There's no more funds that we're going to be using for ERAP. The state is wrapping that program up. They've spent the vast majority of that funding, federal funding. That's why we're seeing some evictions. And then the other program is a new program. It's a different program. It's called the Rent Supplement Program. And that is, the reason it's only 90 people is if it's fully, if we have full enrollment, we'll be paying people's rents every month. It's not a one-time payment. It's a 12-month payment. So when you calculate, if you get some big families and you get some big, these fair market rent reimbursement, it's not gonna go as far as you might think it will go. And this program is supposed to go until the income of the household goes up to the point where they're only paying 30% of their income towards rent. So it's the plan to be a long-term investment. Even though we don't have a guarantee that we're getting it next year. So that's why it's not in our budget this year, next year, 2023.
Thank you.
Thank you, Ms. Plaxton.
Please.
All right, did somebody say something?
Can I ask a clarifying question?
Oh. Yes, Ms. Lakakis.
Say, Commissioner, did you just say that you want ideally people to have 30% of their income to be for the rent?
No, the program goes until their income, they have to be income eligible to initially enroll. It will go until their income is to the point where they're paying no more than 30% of their income for rent. It's confusing to me.
Mr. Cleary?
Yeah, I just want clarification. I think either I heard it wrong or maybe you stated it wrong. You said, don't worry, the utility is gonna get paid. I'd like them to get paid, but I'm not worried about that. I'm worried about the utilities not turning off the utilities. Because the utilities knows they're gonna get paid. Is that what you meant?
Yeah, there's a nuance. And also, utility companies know, they've been turning people's utilities off now because they can. But once it hits 32 degrees, I think, below freezing, they're not supposed to turn utilities off. During this time, we have a couple protections in place during the very, very cold months. But if someone gets really, really far behind, that can be a problem, come spring.
But what your statement was, don't worry, they're gonna get paid. I mean, really, it's more like the utility knows they're gonna get paid once they're in the program, so they're not gonna turn them off.
They'll get notice of approval of that payment, but if they don't pay the next 4 months, that could be a problem. So they apply for November, they get a $700 approval for $700, for instance, in November, but then they don't pay December, January, February, March, then they're gonna be behind by the time spring comes, and that could be a problem.
Okay, I guess I'm still going back to the statement you said. I know you guys are worried that they're not gonna get paid, the utilities. Well, I'd like them to get paid, but I'm not worried about them getting paid. I'm worried about the utilities staying on. I think we're saying the same thing, but That's all.
Yeah, I was say what we say to clients is they always worry because they haven't seen the payment show up in their bill yet, and it takes months for it to show up as a payment from HEAP, that's what I was referring to.
Okay,
But the
thank you.
utility provider has already gotten notification that
They
you
know,
applied.
they know that the person's eligible.
And then there's things in place like the 30 degrees and stuff like that.
Yes, and, I mean, the problem becomes for people on propane or pellets or wood, which HEAP also pays for those. It's not really a utility company. If they have no more fuel left, that becomes a problem. But we have an emergency program. If you have less than a quarter of tank of fuel, you can get an emergency benefit. But
Thank you.
we expect all kinds of stories to be
Thank you.
occurring this winter.
Thank you so very much, Ms. McClave. Ms. McLaughlin?
Thank you, Madam Chairperson. I've stood on people's doorsteps trying to get National Grid to turn it back on for whatever reason.
It's hard.
I've been on the phone, I understand how that can be real challenging. I know the program just started today, and there's a lot of advertisement, every news channel, every 5 minutes was saying, HEAP starts today. Do you know how many applications you got today?
We have quite a few. There was an early outreach that occurred in October to individuals who applied last year that were old, elders and disabled. So we probably have, at least probably between 500 and 1,000 applications so far.
Yeah, 'cause I did my own little outreach saying, apply for HEAP, with everybody that I.
People know about it.
That,
generally.
yeah, so, and those who've gotten it know to pay attention, I guess. But, another question, I'm gonna get off the HEAP, because I think that, people have asked a lot of questions on that. I looked at your special assistant to you, is zeroed out here? Special assistant to the
Oh, that was part
commission?
of our workforce development plan, that's been turned into the data,
The
It was
data,
defunded, it was refunded, and then it was moved to the other position.
yeah, it was moved to the new,
so will they be doing dual work? Is that what that means?
no, it was vacant, it's vacant, it became vacant.
So you don't need an
we used
assistant?
it. Well, I have, I do, believe me, and I have a, executive assistant to the commissioner, there is also a line for that.
Okay, I guess, I must have skipped over that.
And this is my, executive deputy commissioner, Erin
Yeah, I
Hackler.
think we've spoken, yeah, several, okay. My other question I had, mine is very simple, because everybody asked very good questions. Down in the new projects, your Elder Abuse Awareness Month, what month is that?
Is that April or May? Elder Abuse Awareness Month.
It's September.
Oh, I totally was wrong. So yes, we're planning a special event, kind of a recognition for the work that we do in elder abuse prevention. So next September.
Okay, well, I would just hope that as chair of the Elder Committee,
Yes.
I would
yes.
really like to have active participation there with our committee. I think that's all, others touched on what I had. Thank you so much.
Thank you.
All right, thank you very much. Now is the chair of our Elder Care Committee. If there are no other questions? Oh. Yes. You got something else there? You can wait? Oh, okay. I do believe that, there are no other questions. Do we have a comment from the chair?
Oh, yeah. Thank you, Commissioner, for being here tonight. We had spoken about this before, but in September of 2021, myself and legislators Chapman and Simpson were out in the field with two of your employees from the APS unit. There had been some weather, and they were sitting with an individual late into the evening on a Friday night, as this individual needed to be placed somewhere else because their home was no longer safe. I wanted to publicly commend those two individuals, Vanessa and Laura, for their work, what they did that evening. As we talk about staffing and bringing people in, hopefully as we staff up to a full complement in social services, that type of compassion and work towards helping people, because they didn't need to stay there with that individual. They stayed there until that individual wanted to leave their home, which is hard for somebody to do. So hopefully as we staff up and we bring new folks into social services, that type of compassion and commitment can be brought down to the ranks and taught from the new people that come in as they work in the field. I just wanted to commend you and Vanessa and Laura for their work that evening.
Thank you.
Thank you very much.
Thank you.
Thank you so
Thank
much
you.
for coming out tonight, and just want you to know we do appreciate the hard work that you do, and, you know, just keep it up. We do understand how difficult it is. Thank you
Yeah,
very much.
and my staff is special to be able to do the work that they're doing, so I appreciate that feedback. Thank you.
Thank you.
Children, Youth, and Family Services, page 78 in your budget books. Commissioner Manning.
Good evening, Madam Chair and members of the committee. I would like to introduce Beth O'Neill, our Director of Accounts, and Nicole Ward, our Deputy Commissioner. And I really first wanted to thank the staff at DCYF. They go above and beyond every day and really ensure that children are safe in the community. And that's through any of our divisions. We're an integrated children's services department, so we have everything from child welfare, which includes foster care and child protective services. We have children's mental health services, which includes outpatient therapy, as well as care management. And we have our special needs division that looks at children for early intervention to identify a developmental disability, as well as our preschool education for those children who have been identified and need supportive services. You know, our department really does work with the most vulnerable populations, and in this past year, we've really looked at evidence-based practices to ensure that, you know, we do get those outcomes that we want for families, that there is things such as MST, which is multi-systemic therapy. There's family treatment with FFT, which is really helping families improve their relationship, improve the child's behavior, improve things such as attendance at school, and not to get into trouble in the community. So we're happy with that. I think one thing our department continues to struggle with is workforce, but we're not alone. Our neighboring counties and throughout New York State, caseworkers specifically we have a higher vacancy. We have about 18 caseworker positions right now vacant out of a staff of 202. Is that right, Beth? 204, I'm sorry. We lost 2 people. So, you know, we have been, unfortunately, it's where Albany County is located. All the state agencies are right here. So they're taking our staff for OCFS, OMH, Department of Health, and State Ed. And that's where all staff have pretty much gone because they don't have the level of stress of working with families directly, and they do have a higher pay scale. So we are addressing it through various actions. We actually developed a workforce development group. It's actually employees that are bringing their thoughts forward to ensure that we retain these staff. And also, we've been recruiting out at colleges, attending fairs, employment fairs, so we can really try and recruit. We also do some positive things for our staff, such as we just had a staff appreciation for child welfare because October was Child Welfare Month, and we did an ice cream social right in this room for them. We also, on a monthly basis, have Caught You Doing Something Good, and that is an opportunity for staff to say thank you to their peers or colleagues or anyone. Supervisors can do that. I have done that for staff just to recognize that they're going above and beyond. This is a very challenging job, and when you talk about, Legislator Joyce, that, people sit and stay with, individuals and really go in for the long haul. I can't tell you how many times that children who have been removed by Child Protective are sitting on our floor and staff are working until 2 in the morning to find a bed for those children. We've even had a situation where we have had to care for a child who couldn't be successful in a residential program until we found a place out of state that took the child. So that's why I really do applaud the staff. They do go above and beyond. Even though we're short-staffed, everybody chips in. We really continue to be very conscientious of our spending. And this past year, we have had the Families First legislation that was put into play in September of '21. And this is a legislation that is looking at decreasing sending children who are placed in foster care to congregate care settings. They call it QRTP, Qualified Residential Treatment Programs. And this was something that we had to look at very closely, because if we don't meet these timelines of getting a QI, which is a Qualified Individual Assessment, and getting the court appearance to actually the judge to approve that level of care, we lose Title IV-E funding. So, and for the remainder of the case, which could be a huge hit to us financially, because it would be then 100% county share. And it's very expensive, a lot of these residential programs for a daily basis for these children. And the other thing that we're doing with that is really looking at utilizing kinship care. So when a child comes into care, we're really exhausting all of those family members that could be a resource to that individual. And we really want to then make a safety plan with that relative and go through the court process that they can then be the caregivers of that child. And I want to speak a little bit to the partnership that we have with Trinity Alliance. We have a Families First mobile van. It's a small Winnebago, but it's going to be utilized for community outreach, really being in that community and becoming the fabric of that community, so we can be trusted individuals there. It's also an opportunity to provide hardcore concrete services, such as food, such as pack and play, anything those communities may need. And it's, you know, again, being mobile, we can go from the hill towns, we can go to Waterville, we can be here in the city of Albany. So Trinity will be rolling that out, literally, very shortly. They are staffing up at this point. The team consists of a clinical social worker, and she is the team lead. And then we are also looking for, I should say Trinity's looking for a parent advocate. So it's really a family member that has walked in the shoes of someone struggling with different systems. Our systems are not easy to navigate, and this individual would have had experience either in the mental health system, special education, probation, and then the final person in that group would be a domestic violence advocate. We're seeing a lot of domestic violence, especially since COVID. There's a lot of substance abuse and violence in the households. And again, we really do closely examine a lot of our expenditures on a regular basis, but I do want to say that many things are out of our control. We are seeing more children with cross systems, very complex needs, and they are very costly to find residential placements. In addition, the schools can make recommendations for residential placement, and we at the county have to pay the room and board for those children, but do not have a say in the placement of that child, that it is done by the school districts. In addition, preschool transportation is extremely expensive as well, but we are required by mandate that we have to transport children who are at preschool to a center-based program. And then finally, it's really the Office of Children and Family Services, and when we're placing children in non-secure detention, OCFS placement, or secure detention, that those costs all come to Albany County as well. And there were a couple questions I did want to just go through that I received this afternoon. There was a question regarding the increase in the tuition for children in the center-based programs. And Governor Hochul did pass an increase in the tuition of 15%. And the county is responsible for 40.5% of that, and the state provides 59.5%. So that's the reason for that increase. As well as CSE placements, last year we budgeted for 7 youth going into CSE placement. We currently have 9. So there's the significant increase. And that was brought to the legislature and resolution was approved 2022-329. And that was increased the budget $550,000. So that's the reason why there has been an increase in that line, so we can make sure we have enough money to continue with these children. And have also included a little bit of a buffer for 2 additional, because again, we have no control of the numbers. And the state training payments went from 1.8 million to 0, which used to be paid New York State OCFS for children placed in OCFS detention. Historically, they would have sent us the bill and we would have paid for it, but now they're actually just keeping the money and deducting it. So that's why it was zeroed out. Did I say that correctly, Beth?
They're doing a bottom line adjustment from our revenue, so they're deducting it from the rest of our revenue.
And also in partnership with the Comptroller's Office, we've streamlined the budgeting of the revenue. Previously, revenues were tied to an account where the appropriation was contained, rather than having one line for each revenue source. So beginning in 2023, the department and the Comptroller's Office will be able to reconcile the funding and identify outstanding revenues with less calculation. And the changes in those revenue impacts 6071, 6110, and 6119. And the final question I had was the increase in secure detention. And Berkshire Farms, I think as many of you are aware, operate our secure detention up by Albany County Jail. There has been an increase in their budget to us, or I should say CDYCI. And the reason for that is really workforce. Again, that they are challenged with actually finding people. So what they did was have a large media campaign to get and recruit staff. In addition, they have increased the salary for those individuals and also have a sign-on bonus. They have, too, also increased the staffing ratios. So they have a higher staffing ratios because we have a lot of adolescent offenders up there. There have been violent incidents occurring. Staff have been injured. So we want to ensure that there is safety up there and, again, safety in numbers oftentimes. So with that, I'm here to answer any additional questions.
Thank you very much. I just want to start out with this. A couple of weeks ago, I had someone call me. It was a grandmother who wound up with 2 of her grandchildren. And she had tried to get emergency, she wanted to be have emergency custody. Now, she went from us to family court and back to us because she was trying to receive some services. Okay? And so how does one navigate the system? No, you have to do this first. And this one's saying over here, no, you have to go over there first. Okay? Whether it was Medicaid that was needed, okay? And over here on this end, just trying to get them to be able to say, look, I have to go to the hospital, something happened, to one of the kids, so forth and so on. So this kinship care, where does that come in at? Does it start in family court? Does it start with us?
It starts with a removal. So we would be looking at, families are involved with child protective or preventive services.
Okay, stop. The kids had, let me add another level to the story. The kids had already been left with her.
Oh, okay.
The mother
So
was no longer, she just brought them there, didn't go back. Okay? So I just wanted to add that.
Sure, which, again, because if Child Protective did the removal, they would be responsible for making all those pieces happen. So in order to get custody of a child, you do have to petition family court and then to have legal authority over that child. However, with that being...
Did you say that that the child had to be removed first?
No, that's the first example, but in yours, they,
Oh, okay.
you know, they just left it with grandma, and that's, you know, that was a good safety plan. But in order for the grandma to be able to do this legally, she would have to be contacting family court and petition the court for custody. Basically, it would be an abandonment if mom just took off and left.
So how long does it take the mother, or the grandmother, to wind up with services for the child?
Have her call me.
Okay.
Because, and that's the unique thing of the Families First Winnebago. It's actually gonna be a Families First Resource Center, but this is where the kinship comes in. So you're gonna have a team of a clinician, a parent advocate, and a domestic violence. They're gonna be the ones going into the home once we identify a kin resource, and they're gonna help them medicate, what services do they need, and have that warm handoff. The length of time that Families First Resource Center team will be involved is probably about a 2-month period of time. By that point in time, everything should be in place and children's needs will be met.
All right, thank you.
Mhm.
Mr. Peter?
Thank you, Madam Chair. Thank you, Commissioner. And I'll start off with the same question. You know, when it comes to, you know, your senior level staff, non-unionized, you know, how do you view success? How do you view their success and the success of your department?
Well, I think it's really goes back to daily operations, that we're doing what our mission and goals are in the department. We are ensuring that children are safe and that the job is getting done. And, you know, there's kind of tangibles, if you will, that we are meeting the milestones of safety assessments, getting paperwork done, submissions, and that's across all divisions, that we have to ensure, because we're reporting to various state agencies. You know, we have 5 state agencies we report to. And I think as Commissioner McClave even said, you know, location, we're always getting audited. We actually have an audit on Thursday for our Child Advocacy Center through the Office of Children and Family Services. So, and I think the outcomes there, you know, do we have improvement plans that sometimes? Yes, but we're on the right track, and I think you see it through the staff's devotion, that they're getting the job done, even though we're short.
Thank you, Commissioner. Madam Chair, if I could. Thank you. Several positions in the budget left only $1 in some of the positions. Is that because of, you know, is that based on people have retired out of those positions, out of the previous buyout plans, or what's going on with that?
Yep. In this department specifically, those are all from the early separation plan.
Do you feel that you'll need to fill those positions when they come back available?
I think we wanted to leave them there because we want to ensure that the needs, I think COVID has really put us for a loop. We may need them in the future, or we need to maybe use those lines and retitle for what our current needs are.
Thank you. And just one more question, Madam Chair, if I may. One of the things we talked about, you know, we often talk about is that there's you know, and we talked about a little this with the crime victims, you know, part of the budget presentation, but that trauma begets trauma, and that those who suffer from trauma often are the ones who later on in life will either be a victim of trauma, or actually undertake traumatizing someone else. So, you know, we often think of in the city of Albany and other places where there's gun violence and things like that, children who may not be directly experiencing it, as far as like they weren't necessarily a victim of it, but they saw something, in which case they might fall through the cracks of getting services. What I mean by that is like, if they don't know they're suffering, right, they're a kid and they're not necessarily a specific victim per se, although they are a larger victim, how are we seeking out those kids? So one example would, you know, are you looking to schools where the school district can contact you, not if there's domestic violence or something like that, I know the protocol there, but if someone's acting out, and who's connecting the dots to be like, you know, on their block 2 weeks ago, they saw someone get shot, and now they're acting out, and then we also know, or they seem withdrawn and things like that. And look, so I'll leave that a little open to you
Good.
there.
Well, again, all of our staff are trauma-informed, trained, and we really look at trauma because many children and families are challenged. But I do have to say, I'm also working with various school districts in our mental health curriculum. Again, there's a requirement through legislation that all school districts must provide K through 12 curriculum for mental health issues. those type of behaviors and symptoms would be then identified through the curriculum, or the child could self-identify that this is something I'm struggling with, and these could be the reasons why.
I think that
We have some graduate fellows from SUNY, and Dr. Giordano and I are working with them, and they are charged with really seeing how effective this legislation has been and how effective it's being rolled out in the school district, and what the county can do to assist those school districts if they're struggling with implementing it. Because some districts are large. I was just at Bethlehem yesterday. They have a robust program, but when you look at a smaller district with less resources, they may need assistance, and we're going to provide it.
That's great, and we'd be very curious of the results of that. I think as we do things like a court or other things where we're trying to better connect people to services, I think knowing where people may not know that they even need services, especially children, is going to be really key in getting out of some of these problems. Madam Chair, I'm
Thank
sorry.
you. Mr. Bergdorf.
Thank you, Madam Chair. Commissioner, how are you?
Good.
While you have 18 caseworker vacancies, I counted a total of 47 total vacancies in your department from the spreadsheet that you submitted. That's 25% of your department.
And again, we hire all the time, and I do want to thank
Which
the
is
HR Civil Service, right, and the county exec's office for getting staff in. We had, 2 caseworkers start 2 weeks ago. We had another caseworker start this past week. So, I mean, I have the list here. I have two community services worker, a quality assurance part-time, 7 senior caseworkers, and 14 regular caseworkers.
I wasn't questioning some of the numbers, but the same question I asked social services. How do you do it all when you're down 25% employees? They said, some things don't get processed as quickly as they should. You can't do it all the way it's supposed to be.
Well, we can't not.
You can't
We're
not.
talking about, children's safety and
So you're
welfare, so we
doing
have
100%
to.
of the job with 75% of the employees.
And technically, we also have been doing overtime projects, and overtime projects, we've been able to close a lot of the cases out, especially in child welfare, so, because they're always coming in. State Central Registry is operating 24/7, and we are getting the phone call of saying a child could be at imminent risk. We have 24 hours to get out there. I mean, we have to immediately contact the resource and contact the family to ensure there's a safety plan. But if not, they're out in the field.
I'd like to run some numbers by you, because I had a constituent contact me on behalf of the caseworkers, and I realized that this is the story in virtually all of our departments. But the person indicated to me that our caseworker salary starts at $48,800, somewhere in that nature. And Schenectady County starts at $63,000 for the same title position.
I don't believe so.
And that Rensselaer County is about $10,000 above us. And Schenectady recently did away with their residency requirement, and that there are people now looking at, potentially moving for large sums of money. How do you attract and retain staff in this environment?
I think that's what we're doing. We're looking at the workforce retention group. We are trying to bring out ideas that would work. I don't agree, and I can double check with my fellow commissioners in those counties, but that 60,000 sounds extremely high.
Well, I'd like to know if so. 'Cause
And then also, I mean, this is the opportunity during negotiations that the staff should be bringing that forward to their union members and advocating for that.
I realize it's a collectively bargained issue, it's something that none of us have any direct control. I talked to Commissioner about that as well. One of the other things I was told is that the caseworkers are 91% funded. I assume that's by the state or the federal.
the reimbursement's approximately 91 to 92%, yeah.
Okay. Well, I guess the problem isn't that we don't have enough caseworkers. The problem is we don't have enough caseworker staff. So it's not a question of if you needed more authorization for bodies that were going to be reimbursed at 91%. It's a question of getting people in the seats that you have.
And I could also say as well, to actually go through the training of a caseworker, it takes a while to get them trained. That they have, they have to shadow a senior worker, they need to be mentored. There is a stringent curriculum that OCFS provides to new staff. And really, it takes probably about a year to get them up and trained.
Is there anything that we can do to help you?
I think we're taking, the efforts of really, I want to partner more with the schools and look at internship opportunities and almost have a caseworker trainee type status, which we've had in the past, and then, bring them up the ranks. That there is promotional opportunities throughout the caseworker series, starting at a trainee to a caseworker to a senior caseworker to a supervisor B, and then a supervisor A, and then director.
And what are the quals for a caseworker?
They need a bachelor's degree, so typically in the human services field, so that could be anything of psychology, social work. I think we've even had some folks that had an English, but they did, their work that they did was working with children and families, maybe in a residential program or other things. So we really don't have stringent, but those are, needs to be a bachelor's. That's why the caseworker trainee, looking at that as possibly an associate's degree in like a human services.
Okay, and this is all, the candidates come from the civil service test?
Yes.
And where are you currently in the test cycle?
We basically have been hiring provisionally, and so when they come on board, then they will be taking the test. So it's a rolling test, so it's offered quite a bit. Nicole, do you know when the next one is?
There was one on October 22nd. We're waiting for the scores, but as we're getting eligible applications, we're actually working with BOCES to get them into a prep class to prepare them for the test. So that, and then civil service, if we get people in on a Friday, once we get them ready for the test, they're doing the test whenever we need to.
So if you have the quals and you can appoint people provisionally, there's an opportunity for someone to step into a $48,000 a year job.
Absolutely.
If they are so inclined.
And if I may,
motivated to do the work.
and if I may, I think there's I don't know if COVID has done it or whatnot, but we schedule interviews. I want to say the last time we had 10 interviews scheduled and only 6 showed up. So, and I'm not hearing that just from Albany County. I'm hearing it from other county commissioners as well as voluntary agencies. I had a discussion with Bill Getman, and he's just shocked that people don't show up for their interviews.
Okay. Thank you very much.
All right, thank you. Thank you. I just want to ask, now we talked about the caseload, caseworker. What is their caseload?
You have that, Nicole?
This is as of
Speak up.
October 12th of 2022. This is their caseload. I can go down. Some have 2, 5, 4. Here's one with 40, 49, 9, 25. There's nobody over 70 currently, and there's only one person over 70 right now. And that could be the same case that more calls keep coming in on that case. So you have the initial call and then what's called a subsequent call. So it's not necessarily a new case, it could just be more sources calling in the same case.
Right, because you have to, you have to consolidate a case. So if the school teacher does a report, then and it's the same incident, and it's being investigated, but you can't do that until the investigation and then consolidate the report.
Okay, I understand that, can't think of the number, but it's in the double digits of different languages that are spoken in the city or in the school district. Okay, so how do you handle that as far as, you know, what do your caseworkers look like?
I think we have a diverse population, excuse me, of caseworkers. We have been recruiting and we've been getting more male caseworkers, which is great, and males of color as well. So I think that is just helps families feel more comfortable and engaging.
Okay, I understand you said that it's diverse. How would you rate how diverse it is?
I mean, we could always do better, and I think when we're out there in the mobile van, you know, putting up, you know, job specs and such in the barber shop, in the local McDonald's, that, you know, getting more people from the community, and that's something that we're doing with foster care recruitment already. So recruiting foster parents, but we want those foster parents to look like the children that are gonna be entering their home. And so that they understand the culture, they understand the child, and there's much more of a positive connection.
Okay, I understand what you said about the foster care and the parents. I'm really concerned too about the caseworkers, because they're the ones that have the initial interaction, you know, with the people. And I just want to voice my concern that we begin to have more people out there that address what Albany County looks like, so that we know there are cultural differences amongst different people. And so I believe you have to be able to understand that maybe the way of someone interacts with family, and whether it's a Latino household, whether it's African-American household, and if I were to begin to name the number of different, you know, other different races and cultural groups that are out there, I would really love to see a little bit more work done in that area to promote an understanding of the people that we have to serve. That's all. I'm not saying that you're not doing it. I'm just saying that, you know, we are changing, and we need to assure that, you know, there's equity in our workforce to address the diversity that is in our population in Albany County. So, Mr. Grimm, did you have your hand?
Yeah, thank you, Madam Chair. In your memo to the committee, item 15, the performance metrics, you indicate that there's a lot of these metrics, but basically the federal, state, and local streams of money that you have to adhere to. And I'm really interested in metrics that speak directly to practical outcomes. For example, it seems to me one of those would be how many children come to you with need from some inappropriate circumstance? And then at the end of the year, how many of those children are placed in appropriate settings? That to me would be one of the most important metrics. Do you have things along those lines at all?
See, I think in each program area you could. I would still love to really see, because I came from early intervention and mental health, and the children that I saw in early intervention, I would see in mental health. You know, is there a way to be able to track all that data? It comes into issues related to HIPAA compliance, and we can't share information across state agencies. But, you know, I know in the mental health system, we can track that. We would know in the early intervention. It gets more tricky in the child welfare, because there's that, I mean, we know which children are placed in residential care that bump up to that higher level of care. But when you're talking about reports, thousands that come in annually, and you get subsequent reports, that's a little bit harder to actually track on the timeline.
Well, the reason I say this is because you have all this bureaucracy, and compliance, and I'm sure is a nuisance to go with compliance. But the real questions are, how many solutions are you providing? And the most fundamental one is moving a child from an inappropriate setting to an appropriate setting. So it seems to me that's a really important thing to try to figure out how well you're doing. That would be, to me, is the most important metric, and I'm sure there must be a way.
I'm sure, and I can look into that. Because again, the handful of children we have that are in foster care, I mean, I would even think with the Billings, the juvenile justice project that we're doing this week on the probation.
So right now, we have a researcher that we contract with at the University of Albany, and her and our juvenile justice coordinator are working with prevention, or with probation, to do a really deep dive to see if youth that are interacting with prevention have hit any of our other systems. So did they come into prevention and still penetrate deeper into the system? So we're doing that right now. Hopefully the report will be out soon. And then prevention also next year has to be a part of our county plan. And we're working with the Red Lake Horowitz Foundation, which the legislature has approved the money to do a deep dive into that too, to really look at our prevention. What different organizations in the community that we're partnering with, and what the numbers look like. Are they successful?
And I think the other piece of that is, as I said in the beginning statements, that we're looking at evidence-based programs, and our prevention programs are really gearing towards all evidence-based. So these last contracts that have gone through, now we're going to be able to get the data that did the parent functioning improve? Was the child able to maintain safely in the home? Did attendance improve for the child? So there are going to be a lot of factors that they're evidence-based, so there's a lot of validity to and tracking and assessment of those
And that-
outcomes.
That also enlightens a little bit about what really works.
Mhm.
Because
Oh,
every
definitely.
agency, and every business for that matter, how many people are spending the most time on the things that matter the most? And if you don't track what matters the most, then you really can't wind up there.
Mhm.
Right, thank you for your work.
Thank you, Madam Chair.
Thank you so much, Mr. Grimm. Are there any other questions?
Blush?
If not, I just want to thank you so much for your presentation. Everyone was very thorough tonight, but this is one of the most important agencies that we have. And we all need to be assured that we're doing everything we can to take care of the over 300,000 people that Albany County is home to. So I just want to let you all know that we do understand the hard work that you have in front of you and all that you've been through over these past 3 years here. So we appreciate you, and we want you to know that, and we do not take you for granted at all. So, all I can say is keep up the good work, and we thank you.
Thank you. Have a good night, everyone.
Thank you.
I got a couple. Okay, one more, hold it. Let me just say this to you. Tomorrow night is Part 2, Human Services, Health, Mental Health, Aging, Nursing Home, and also upstairs, Adopted Family. They are doing the raffle tickets, so we just want to make sure that everyone participates. And it's on the, until the 18th of November. And the drawing is the 21st. This is something that we've done for many years now. So please participate, and can I have a motion to adjourn?
Madam Chair.
Yeah, 2 minutes.